Welcome to BW Healthcare World. Today is World Liver Day, and we have very special guests who are going to be talking on the theme of this year, which is be vigilant, do regular liver checkup, and fatty liver can affect anyone. We have with us Dr. Balachandran Menon, who's the Director, Department of Liver Transplant at the AIG hospitals. He has performed and assisted over 2,000 liver transplant surgeries. And along with him, we have Dr. Neerav Goyal, who's a liver transplant specialist at the Apollo Liver Transplant and Pancreatic Surgery Unit and is currently working with the Indraprastha Apollo Hospital. He is the one who started the unit at this hospital. So welcome, Dr. Balachandran Menon and Dr. Neerav Goyal.
Thank you.
Thank you. Thank you.
Keeping in mind the theme of this year, but I think, we must begin with the basics of trying to understand what the problem is and how it is affecting our nation. So, Dr. Menon, let me begin with you. What do you think is the current burden of liver diseases in India, and what are the major contributors to it?
Liver disease in India actually is responsible for almost 3 lakh deaths per year, and which actually contributes to about 20% of liver-related deaths worldwide, which is a very, very high number. And out of this, the main contributors are alcohol, NAFLD or the fat-related liver diseases, hepatitis, which could be B, hepatitis C, hepatitis E. Fortunately, we don't have hepatitis D in India much, and there are a lot of these pediatric liver diseases. So yearly, the liver load, the liver-related disease load is still increasing. A lot of countries have been able to actually control it, but in India, it seems to be still on the increasing trend, especially the NASH or the NAFLD or the fat-related liver disease.
Right. Dr. Goyal, is there some kind of a demographic stats that we can observe among the people who are coming with liver diseases? Is there specific, typical age bracket or the backgrounds that they come from, or is there any gender, which is getting more affected with liver problems?
As far as chronic liver disease is concerned, about 19% of the population, of the patients who are hospitalized will be from liver disease. And amongst these patients, if you look at the breakup, then ethanol is a pretty common reason. That is alcohol consumption, at least in India. It's a pretty common reason. It's somewhere around 15% of the patients will be alcohol related. Similar, about 15 to 20% would be hepatitis B related cirrhosis, that is end-stage liver disease. Hepatitis C was very common till 5 years back. In fact, in our unit, commonest reason for a liver transplant would be hepatitis C till 5 to 6 years back. But now with the advent of the newer drugs, direct-acting antivirals, which are there, and this hepatitis C incidence has gone down. So presently, it is somewhere around 12% to 15% of the patients would be hepatitis C-induced chronic liver disease. As far as age bracket is concerned, amongst the adult patients, usually in the starts in third decade of life, peaks somewhere around in the fourth and the fifth decade of life. And for chronic liver disease. And liver cancers, we see more in fifth and sixth decades of life. NASH, that is fatty liver disease, is the new epidemic. WHO also recognizes it as a new epidemic in the world. And that is now increasingly becoming more common as a cause of chronic liver disease. And in fact, since the HCV has gone down, NASH has really increased in its, in the danger of it causing chronic liver disease. And we see patients with more advanced malignancies also with NASH. Acute liver failure is another thing which is more common slightly in the younger population. We see hepatitis A and E, but in the Indian subcontinent, hepatitis E is the commonest cause for sudden damage to the liver, which leads to an emergency situation where sometimes a transplant is required within 4 to 5 days of the patient developing acute liver failure. Males more common in India for compared to females for chronic liver disease.
So, Dr. Balachandran, let me just come to you because if it is the effect of alcohol, the food that we eat, the socio factors, do we find any difference in terms of the demographics that we have seen in North India versus South India? What is your observation about the demographics?
Well, the incidence is almost the same. If you look at alcohol, some states do have higher incidence of alcohol. It has been estimated, surprisingly, the figures are quite high. 16 crore people are supposed to be alcohol consumers between the age group 10 to 75, which is an extremely high number. Now, some states do have very high incidence of alcoholism. So in down south, a few states like Kerala, Telangana, they do have higher incidence. Similarly, if you go to Northeast, some states do have higher alcohol incidence. Similarly, hepatitis B and C, there is a little bit of regional variation. Hepatitis B in India constitutes about 5% of the population. And hepatitis B incidence is almost equal in all states. Hepatitis C, although the overall incidence is hardly 0.5 to 1%, but there is extremely high incidence in some areas of Northeast, some areas along the Pakistan border. So there is a little bit of variation, but overall the incidence remains same. NASH is universally going up, as Dr. Goel also pointed out. It's the new endemic, which WHO has actually, he's portraying it as a epidemic, and a lot of, in fact, Indian government is also doing its best to actually increase the awareness of NASH.
Dr. Goel, let me come to you. What we have observed and what we have, what the internet and the information that is coming from the medical fraternity suggests that more and more younger people are now getting affected with liver diseases. Apart from alcohol, is there something else that could be contributing to this particular problem?
See, if you look at the Indian population, the traditional eating habits of the Indians, and they're all now being replaced with the internet savvy young generation being more and more going towards junk food, eating unhealthy diet. So the carbs in the diet have really gone up. The fat content in the diet has really gone up compared to the traditional Indian food, which was there maybe one generation earlier. And at the same time, a sedentary lifestyle, long office working hours, sitting jobs, these have also contributed to unhealthy environment leading to liver disease. So the calmness, as has been mentioned, the NASH epidemic, the fatty liver disease epidemic, it is coming because of this, that because of the unhealthy eating habits and a sedentary lifestyle. So very easy to prevent. Like eating a balanced meal, avoiding alcohol, which is, WHO has recognized that amongst the world's population, India is amongst the fastest growing population with alcohol consumption. And in fact, till a decade earlier, the boys were more in number drinking alcohol, but the number of girls going up on alcohol consumption has been, exponential in the past decade. So all these things taken together is responsible for younger lot coming up with chronic liver diseases, with problems, fatty liver being a very common problem in our outpatients. And balanced diet, daily exercise is all that is required to beat it.
And Dr. Goel, what are the common symptoms of a liver problem? What is it that somebody can see or observe and know that, the liver needs attention?
See, one of the commonest symptom and the most ignored symptom is weakness. They start feeling fatigue, the inability to carry on daily activity with the same zest and with the same energy as earlier. So weakness, change of sleep cycle, not getting enough sleep in the night, feeling more sleepy during the day. These are the early manifestations of something going wrong with the liver. Later on, it's only with the advanced disease that one starts getting jaundice. Jaundice amongst the population is they think that's a very common symptom of liver disease, but it's not really. For chronic liver disease, it may really come late. So they may start feeling jaundice. They may have dark urine. Sometimes later on, as the disease progresses, they may have swelling in the legs, fluid accumulation in the body, swelling in the abdomen with fluid accumulating in the abdomen. And sometimes they may have bleeding episodes like a blood vomiting or passage of black colored tarry stools, which indicate an advanced chronic liver disease. But generalized weakness is one of the commonest, earliest symptom which should alert a person to visit a doctor's office.
Dr. Menon, the problem is that when somebody has a symptom, they will go and get a test done, they will go and get the treatment and everything from a specialist. But when we are talking of prevention, and we are talking about, in fact, the theme this year is to do regular liver checkup. What is the importance of getting the liver checkup done even when you do not have any symptoms? And why do you think this should become a mandate? I mean, even if not by the government, but a moral mandate by the family?
Yeah, actually, all these diseases and all these causes take a pretty long time for the liver to get involved. And the liver disease also progresses through lots of stages before it becomes frankly cirrhotic, needing a transplant. So that could be even 25, 30 years. So any lifestyle modification, any prevention in between can actually stop the progression of the disease. So that's why a good follow-up, repeated tests, which are very simple, can actually diagnose, and you can take preventive measures. It is like getting a hepatitis B and C. It's a simple card test, which barely takes 5 minutes and a couple of drops of blood. And a yearly or once in 2 years, just a fibroscan or a common ultrasound. These things are enough to pick up any significant liver disease. A fibroscan especially can pick up, it's a very simple test. It's a non-invasive test. It can pick up early liver disease. A liver function test, a common blood picture. These are the very simple investigations which should be routinely performed starting from as early as 20 years of age. Once in a while, initially it could be once in a couple of years. Once you have reached 40 or cross 40, it might be advisable to do it at least once a year.
Dr. Menon, since you spoke about that, the liver problem could take some time before it reaches a cirrhosis. And I'm sure that there are these stages of liver damage that happen. For a common man's perspective who may be listening to us today, can you explain these different stages of liver damage, and at which stage do we need or one may need a liver transplant?
To reach the stage of liver transplant, you have to do a lot of damage to your body, and you have to be very, very, very careless, and you don't believe in your taking care of your family. So it's you have to insult yourself quite a lot to reach that stage. So what is required? The liver disease initially goes through various changes, and a common fibroscan can show you the grades of fibrosis, the grades of fatty liver. It goes through F1, F2, F3, similarly S0 to S4. So these all take a pretty long time. you can easily convert. If you start doing lifestyle modifications, you can actually revert back F2 fibrosis, S4 steatosis. So all these things can be easily picked up on fibroscan. From this stage, it eventually progresses to cirrhosis. And even when they develop cirrhosis, you've got lots of stages like Child's book A, B, C. So those are basically medical terms. But for somebody to be cirrhotic, to become symptomatic itself takes many years. So if picked up in time, and if you do lifestyle modification, if you control your diabetes, control your NASH, stop alcohol, and do regular exercises, you can actually put a stop to it. So routine investigations, picking up in time, and once in a while consulting a doctor is pretty important. And one more thing, always avoid unnecessary drugs.
Yeah, that's a very important point that you've shared, Dr. Menon, that avoid unnecessary drugs. The reason I want to bring this up and focus on this is because in India, we have seen self-medication being one of the prevalent things in the families. So best is to go get medical help rather than taking it in your own hands. Dr. Goyal, I want to come to you now. What kind of liver ailments are prevalent in children? And are these typically by birth, or is it something that start at an early stage? And are these curable?
See, a lot of liver ailments can afflict young children, and many of them are since birth. They can be kind of divided into things which start after birth and then which are present since the time of birth. Since the time of birth, it may be because of maldevelopment of bile ducts. So what we come across, the commonest liver disease requiring actually patients ending up with a liver transplant is biliary atresia, in which the bile ducts are not formed since birth. And while the child is in the womb of the mother, there is, because of some infection, because of some immune problem, or because of some congenital problem, the bile ducts malform and they start developing jaundice. And by the time they are 5 months or 6 months of age, they end up requiring a liver transplant. This is by far the commonest disease, liver ailment, which requiring liver transplant, which afflicts young children. Besides this, there are a lot of communities where there is a lot of consanguinity, amongst the parents belonging to the same family background and marrying within a community, where we come across more and more metabolic causes, inherited metabolic causes, which get enhanced because of a common gene pool, and leading to early diseases. Like you may have hemochromatosis, where there's iron deposition, primary hypolipidemia. You may have certain diseases like progressive familial intrahepatic cholestasis. These are technical terms. I won't go into that. But yes, a lot of metabolic causes, copper deposit occurring in the liver. These all can occur when there is a lot of, a common gene pool being shared amongst the parents. So, besides this, some diseases can occur later on in life. They can also acquire viral infections in children can occur. If I say mother is hepatitis B positive, she can transmit that to the child if proper precautions are not taken at the time of birth. And these children will become chronic hepatitis B carriers and can develop, cirrhosis or cancers when they are in the peak of their youth, by about end of second decade or in the beginning of third decade. They will end up in a hospital. So both sides of disease can occur, but amongst the children, commonest what we encounter regarding liver transplantation is biliary atresia.
Dr. Menon, we are talking about liver transplant. I mean, this word has come up several times in our discussion today. What are the prerequisites of being a liver donor? Sometimes this is taken very easily in conversations that, liver regenerates itself, so it is okay to, but I'm sure there are some prerequisites for who can be a liver donor. And also, if you would want to shed a light on what is the current scenario of liver donation in our country, what are the challenges that we may be facing?
Liver transplant is basically of two types. One is the live related, where the family member donates. The other is the disease donor or the cadaveric transplant. So in living donor, it's basically some related person in the family. Yes, unrelated donations are also recognized by law. So a fit donor between the age groups 18 to 55, although everyone has taken even much higher age groups, but should be between 18 to 55, normal liver function test, no diabetes as far as possible. If diabetes is there, you should have the HbA1c controlled. Somebody, the donor should have a normal liver function test. Ultrasound wise, the fat should be minimal. In case there is a doubt, we always do a biopsy, and in biopsy also, the amount of fat should be less than 20%, no fibrosis. So one thing everyone should remember is when they are going for transplant, the youngest, fittest, and the thinnest person in the family should donate. So this not only hastens the recovery of the recipient, but the donor also eventually recovers fast, gets back to his normal activities. Coming to disease donor transplants, in India, the numbers are still limited, although it's been going up significantly. Living donors, this year I expect it to touch 3,000, which is the largest number in the world. South Korea is a distant second at less than 2,000. So numbers of living donor is going up considerably, but ideally it should have been the other way around. Disease donor should have been going up. In a country like US, there are 10,000 disease donor donations. In China, there are about 5,000. But in India, it hardly comes to about 7 to 800. So we are actually losing out a lot of good livers, which could have been transplanted. So the awareness still needs to pick up in India for a disease donor transplant. So when you have a disease donor, we can expect, we basically don't have much time to work up the liver. So liver ultrasound wise should have minimal fat. In case there is a doubt, we do on-table biopsy. Liver function test should be literally almost normal. So we do have to actually make a few exceptions when we are doing disease donor, but we should remember that we are actually giving a full liver. So recovery is good in both. Disease donor transplant is more of an emergency surgery. Living donor transplant is more of an elective surgery where you have prepared the donor, where you have the recipient in his best of health. So probably the results of living donor in India for a similar patient is probably better with living donor as far as now.
Dr. Neerav Goyal, would you want to comment on this on the basis of your experience in Apollo?
Yeah, absolutely. As Dr. Menon has very rightly mentioned, the disease donation rates need to go up in the country. Right now, if you look somewhere around 15% to 20% of the transplants occurring in the south of the country are disease donation, whereas in north is about 5 to 8% of the transplants. So, if you look at the world scale, India does not even figure in the for the disease donation. And one needs to government needs to put in more effort. We as a transplant community need to put in more effort. As a medical fraternity, we need to put in more effort to increase the awareness, to raise the bar, so that more and more people come forward for donation. I mean, like if I want a transplant done, or if you want a transplant done, you would always prefer that cadaveric donation, that is somebody who has died, donates rather than one of your relatives gets operated upon. And I think one of the main, there are many reasons why it is lacking, but one of the main things I think is, in your lifetime, you hardly ever discuss this topic with your family. I mean, like your near and dear ones who are the decision makers at your demise don't know about what your choices were in your life. So I think if this simple thing is done, many times we face patients who do not know what that person wanted, and it's very difficult decision for them to take. So, but if it is known to them, I think it's the easiest decision for them to take. I mean, like there is not much of counseling required. They just say, they come up themselves and say that this guy wanted to donate, please doc, we want to go ahead. So I think it is very important that this becomes awareness comes to such a level that every household discusses this at home, and I think that would change the whole scenario.
That's brilliant. I think, what emerges out of this is that there's a lot of awareness that needs to be created for people to, purposefully and in a very, outward manner, go pledge that they would want to donate their liver and let their family know that this is something that they wish for it to happen. Dr. Menon, let me come to you. I mean, since the theme of this year is also fatty liver and it has been recognized by WHO as one of the endemics, what is fatty liver and what causes a fatty liver?
Fatty liver is, in simple words, the amount of fat in the liver going up. So worldwide, as you said, it's a big endemic. It is estimated that 2 billion population is affected by this disease. It's a huge number. And in India, as of now, it constitutes roughly about 25 to 30% of overall liver disease. And not only bad livers, liver going into cirrhosis, even the incidence of cancers in NAFLD is going up. And one more thing that we should remember is it's not only the fat people who have bad livers. There are thin NASH people as well, people who are thin, walking around, looking quite fit. But when you do a simple ultrasound or a fibroscan, you see a lot of fat in the liver. These are the so-called thin NASH people who also constitute a very large number. So just because you're thin, muscular, active does not really mean that you may have a good liver. So please get yourself tested. And yes, control the diabetes if it is there. Always rule out diabetes. See to it that your sugars are under control, HbA1c values are good. And one more thing what anyone should remember is there are a lot of these medicines which have been described for NASH, but they are really of questionable value.
Yeah, that's very important that you brought it up. Dr. Goyal, how can someone prevent a fatty liver? I mean, like I said earlier, we have observed that it is, though alcohol is directly linked to fatty liver, but there are people who have fatty liver who have never tasted alcohol in their life. But so if you can shed some light on what someone needs to do to prevent fatty liver, in fact, for healthy liver, for maintaining a healthy liver.
It is surprising when you look at the pathologies of fatty liver disease. Majority of the liver diseases, be it alcohol, be it purely NASH, or from some other disease like hepatitis B, C, ultimately the damage occurs through fat accumulation in the liver. The end result is fat accumulation in the liver, which then starts the whole process, the inflammatory cascade leading to chronic liver disease. And India is becoming the diabetic capital of the world, and this NASH is not going anywhere. It is going to increase. So I think most important one is that one should have a balanced diet. Junk food and all. As I said earlier, traditional Indian foods are the answer. So one should have a healthy, balanced diet, as well as do daily exercise. 4 to 5 kilometers of brisk walking a day is enough. I mean, like one should do daily exercise. One should have fruits like orange juice or lemon juice. They are rich in antioxidants. There are studies which have shown that a cup of coffee, 1 or 2 coffee a day may help. Okay, provided the patient does not have acidity problems. And avoiding junk food. If one is diabetic, one should control diabetes very strictly. Diabetes is a disease which affects the entire body. It's not only the liver. It'll weaken the heart, it'll weaken the kidneys, it'll weaken the blood vessels, the muscles, as well as the liver. So and the kidneys. So it is very important for diabetics to keep the sugar under control. Otherwise, 10 years down the line, they'll start having multiple issues. So to control that and avoid unnecessary medications as well. There are injuries which occur in the liver from self medication, taking drugs which are not well tested and with the unproven efficacy. So I think basically a healthy lifestyle and a balanced meal should serve the purpose in majority of the cases.
So, Dr. Menon, which are the liver conditions or ailments that are irreversible?
Almost everything is, except once they go in for cirrhosis. So cirrhosis is like the structure has been damaged. So that is irreversible. But yes, you can put a stop to it. You can slow down the progression, but you cannot revert once it goes to cirrhotic stage. Early fibrosis, steatosis, all these things can be reverted by lifestyle modification and some antifibrinolytic drugs. But once cirrhotic, you have to, unless you change your lifestyle, unless you do, as Dr. Neerav Goyal said, you change your lifestyle, do exercises, change your dietary habits. So if you do that, yes, you can slow down the disease. So no drug as of now actually reverts the cirrhotic process. All these drugs which are available in the market actually are against the symptoms of liver disease. So if you do suitable changes in your lifestyle, yes, slow down the disease, but none of these medicines are actually going to get it back to normal.
Got it. Dr. Goyal, can you share some myths that may be related to liver health? Something that people just believe it to be true, but it's actually not.
We do come across a lot of patients who, I'm not against the Indian medicine. It's a very good system, I would say, Ayurveda and all that. But I see a lot of patients coming, chhad bhoos karake, they'll put some beads in the neck. Majority of the jaundice patients who we come across will have a string of beads across the neck, and it is okay. It's your belief system. It's okay to do all the methods you want, but don't delay your meeting with a doctor of the field because of this. I mean, like, one may continue with your traditional medicines and everything, but you should consult a trained specialist early on in your disease rather than late. We come across a lot of patients who will come and say, I just drink a very small amount of alcohol in a week, and I should not be having liver disease. Why did I develop it? But it is alcohol in any amount is going to damage the liver. There are no specific guidelines of how much alcohol you can consume. Each individual alcohol will affect in a different way. So one should avoid these things. One should have a healthy lifestyle is very important.
And are soft drinks and are these all right, or these also damage?
They're very harmful. I mean, like, you look at the sugar content of these soft drinks, and as well as forget the sugar content, the chemicals in these drinks. They're extremely harmful. They're not only harmful for the liver, they are harmful for the entire body. You can have kidney damage from these things. You can have cardiac problems and liver. Yes, definitely. I mean, like, unhealthy habits. These are part and parcel of the junk food. which we keep on talking about, and people need to understand this.
Dr. Balachandran, I have a very important question, and this is something that I've been hearing and people wanting to know that post-COVID, people have been talking about that after COVID, people are getting heart conditions, etc. What has been the effect of COVID that you have observed on liver, if any?
There are lots of papers. In fact, even from AAG, few papers had come up. Significant amount of liver enzymes going up has been noted in a significant amount of population, especially the transaminases, they go up. Few patients have presented with features suggestive of sort of, I would put it in simple words, something like intrahepatic obstructive jaundice. I mean, intrahepatic, you see a lot of actually the bilirubin going up, and most of these tests will be normal. So a lot of spectrum have diseases have been described, whether it was COVID related or because of the medications, these things we really don't know. Yes, some of the chronic liver disease patients who were actually not severely symptomatic, who were probably would have been picked up on diagnosis. So this was probably the subgroup which got affected by COVID.
So, Dr. Menon, what is your message to the world, to the population in general on this World Liver Day? And also, what would be your message to the medical fraternity linked with the liver conditions, helping people solve their liver conditions?
So that's an interesting question. First, coming to the general population. As throughout this last half an hour, we have been pointing out, yes, go back to the basics, do exercise, avoid junk foods. That doesn't mean don't take something for taste needs to be taken, but avoid fatty foods. As we were discussing, avoid a lot of these cool drinks, avoid herbal medications, avoid medicines as far as possible. So have a good diet, have a good night's sleep, avoid stress, be more active, try to spend at least half an hour to 1 hour daily doing aerobic exercises. Coming to the medical fraternity, liver disease takes a long time to affect the liver. Encourage the patients to have routine checkup and treat or modify the lifestyle, treat the conditions, pick it up early. And yes, if somebody with cirrhosis comes, keep them on symptomatic medicines. But once they start becoming weak, liver is actually gives the vitality and vigor to the body. So once they start becoming weak, once their lifestyle starts getting affected, once their work or their business or whatever starts getting affected, it is at that point you should start advising them transplant. Any patient coming for transplant in a relatively healthy stage can have almost 100% result. So if the patients come in late, you may not be able to give a good result. So ultimately it is, if they have to go for transplant, they should come in early so that they can get back to work and get back to normal life at the earliest. So anybody who has had a transplant almost has a normal life, which is just about a year or so, less than a person who is absolutely healthy and did not have any liver disease. So it's almost normal life.
Right. And any message for the medical fraternity, sir?
Yeah, that's what. So medical fraternity should diagnose things early, refer them for early transplant. Yes, if there are any things which could be stopped, like hepatitis B, C, treat them. Yes, pick up the malignancies early. There are lots of ways you can treat the malignancies and even before they get advanced. So even with advanced malignancies now, there are so many things that we can do and bring and make them transplantable. So it's not, I mean, don't put the patient or give a dismal hope to the patient. So there are lots of ways they can still be helped.
Dr. Nirav, what would be your message on the World Liver Day?
I think prevention is better than cure. I mean, this needs to be understood. And one can prevent liver disease. As Dr. Menon has mentioned, it's a long drawn process when the liver really becomes cirrhotic and unrecoverable. Before that, there is a lot of time to avoid it. So one needs to do lifestyle modifications, daily exercise, eat a healthy, balanced meal, and avoid alcohol as much as possible. And I think regular checkups are important so that if there is a problem, it can be picked up. Control your diabetes. And before anything else, I think each and every household should discuss amongst themselves about your end, about the process of organ donation, whether you want to be a donor or not. Make it clear in each and every family, because that's the way one can eventually end up doing good even in death. One individual can save 9 lives. One can donate heart, 2 lungs, 2 kidneys, liver can be split into 2, pancreas. So in one's death also, you can do good to so many others. So I think this should be discussed. Each and every household should discuss in their this thing about their wishes, and their loved ones should know about it.
That's a very good message, Dr. Menon and Dr. Goyal. It is a very beautiful and a very useful conversation that we have had today. Thank you so much for taking our time. My takeaways from this conversation are that, I kind of got hooked onto that word. Don't insult yourself to reach this stage of liver transplant. Don't do disservice to yourself. Don't do disservice to your family, because you put everyone else in a challenged situation. And first thing first, modify your lifestyle, ensure that you do regular checkups, control diabetes, control NASH. And like you said, Dr. Nirav, that prevention is better than cure. And one big message that I take away and I would like to reiterate is to create awareness of the donors, that you can donate and save lives. So many good livers are being lost, and they're being burnt or buried, which could have saved somebody else's life. So with that, I want to thank both of you, Dr. Menon and Dr. Goyal, for taking out time. I know you had surgeries, you're getting late, and so I really appreciate and gratitude for your time today. Thank you so much.
Thank you.
Thank you, Mr. Bye.